Hello, I'm Jennifer Frieden, a Regional Risk Manager with ProAssurance. The practitioner-patient relationship is one that, for the practitioner, carries the weight of abiding by rules of professionalism, standard of care, and ethics. There are times when a healthcare practice must evaluate whether to terminate a patient relationship. Prior to terminating a patient relationship, ask the following questions. Is withdrawal of care based upon valid reasons such as abusive, unsafe, or disruptive behavior? Have steps been taken to manage the patient's behavior, and have these steps been documented? The determination to end a patient relationship is a final step that should occur only when necessary and pursuant to an approved policy. Certain situations clearly point to patient termination as a needed solution, such as when a patient exhibits threatening or abusive behavior towards staff and providers. However, outside of extreme circumstances, practices must be careful to avoid impulsive terminations when patients voice complaints or disagree with their treatment plans. Sometimes, patient relationships are salvageable even after unpleasant encounters. It is important to have a seasoned provider or staff member discuss with the patient what has occurred, why behavior expectations of the office were not met, and that any such continued behavior will jeopardize the patient's relationship with the provider and practice. Thorough documentation is critical to support the necessity of patient termination. All actions or conversations relevant to a patient termination decision should be charted in detail to illustrate what transpired leading to this outcome. Seek to objectively describe the situation without disparaging the patient and use quotations where appropriate. The record should reflect any attempts by office staff to professionally resolve the issue. To avoid patient abandonment concerns, consider whether the patient is being seen for an acute or urgent condition and whether the patient is considered stable. It is recommended to document the rationale for patient termination at this time, including appropriate care transition. Your notes may prove significant should a post-termination adverse outcome occur, leading to allegations of neglect of the patient's medical needs. Upon dismissing a patient, be sure to provide a medical records release form with the final letter. Whenever feasible, patients should be afforded adequate time to find a new healthcare provider. It may be helpful to reiterate the patient's specific diagnoses, and you should include certain risks to the patient if he or she does not follow up with a new office. Patient termination is an unfortunate but sometimes necessary step when the relationship is no longer beneficial or safe. Following the guidance discussed will create firmer footing to move forward with this difficult decision.